This workshop is part of a series on social media communications created with support from the Canadian Institutes of Health Research and the Pacific Institute on Pathogens, Pandemics, and Society. To access other workshops in this series, visit youtube.com/@PIPPSBC. That's @PIPPSBC. Simon Fraser University respectfully acknowledges the Musqueam, Squamish, Tsleil-Waututh, Katsi, Kwikwetlam, Kakite, Kwantlen, Semiahmoo, and Tsawwassen peoples on whose unceded traditional territories our three campuses reside.
Hello, everyone, and welcome to this video on health communication and online abuse. I'm Heidi Tworek, a Canada Research Chair in the History and Policy of Health Communications and an Associate Professor of Public Policy and History at the University of British Columbia. I also direct the Centre for the Study of Democratic Institutions at UBC. I'm the principal investigator on a project that's investigating the online abuse of health communicators and responses to this problem. The research is supported by the New Frontiers in Research Fund from the Social Sciences and Humanities Research Council, whom we thank for their support. Now, before my colleagues and I share this research, I'd like to acknowledge that I am recording this video on the ancestral, traditional, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, who've called this area home for many thousands of years and continue to do so today, and on whose land we have the privilege of gathering and learning. And I'd like to invite you to reflect on the Indigenous lands that you are on today. Now, I am leading this project with Dr. Chris Tenove, who's the Assistant Director at the Centre for the Study of Democratic Institutions and a Research Associate and Instructor at UBC School of Public Policy and Global Affairs. We have a wide range of interdisciplinary academic collaborators on this project: Elizabeth Dubois from the University of Ottawa, Saima Hirani from UBC, Jaigris Hodson, and George Valencianos from Royal Roads. Now, George unfortunately cannot join us today. So you're going to learn a little bit more about each of our research fields shortly. And finally, we have 4 UBC graduate students who are helping us conduct this research and organize the work: Saba Haq, Hannah Het, Maliha Siddiqui, and Oliver Zhang. And we also want to acknowledge Science Up First, which is partnering with us on this project. Now, in this video, my colleagues and I are going to address multiple aspects of the problem. We're going to look at the forms, impacts, and responses to online abuse. And we're also going to include a couple of questions and scenarios to work through so that you might be better prepared to face online abuse or to support those individuals who face this problem.
Thanks, Heidi. I'm just going to pop in at this moment to clarify the learning objectives for this workshop before we dig more deeply into these issues. So, by the end of our presentations and our suggested activities, we expect that participants should be able to first explain why health communicators faced greater online abuse and hostility during the pandemic. Second, be able to describe various forms of abuse and hostility that health communicators face, and including some of the differences that may relate to individuals' gender, their racialization, or other aspects of their identity. Third, you should be able to understand the professional and personal impacts that online abuse can have. Fourth, you should be able to identify a range of responses and forms of support that may be pursued to address online abuse. And these could include actions that you take as an individual or policies that organizations may pursue. And fifth, I hope that by the end, you can propose strategies that you and your organization may wish to put in place. So back to you, Heidi, for some context regarding online abuse during the COVID pandemic.
Now, health communication is important, has always been so, and was even more so during the pandemic. And as you all know, the response to COVID-19 has prompted unprecedented demands on health communicators. We saw incredible efforts by public health officials and other communicators, a few of which are pictured here. Much of this occurred online, where there were really some terrific new contributions. These included the digital native messaging of Science Up First to address misinformation, the creation of the South Asian Health Network and other community-focused efforts, plus campaigns on TikTok and other new platforms, including by scientists like UEC virologist Anna Blackney. Now, we in our research think of all the health communicators who stepped up during the pandemic as part of a community of practice. But in addition and alongside all of the terrific contributions, they also shared many challenges in going online, and this included online hostility and harassment. Now, what we unfortunately saw is that online abuse has worsened considerably for health communicators during the pandemic. There were some broader factors: the increased use of the internet, or increased political polarization and general online hate, including against people of Asian Canadian or Asian descent, Jewish people, and so on and so forth. But there were also specific factors in health communication as well. They included resentment for perceived and actual hardships, mental health challenges, and then politicization of public health policies in multiple different ways. So now, having laid that groundwork, I'll hand it over to Chris to explain the forms that this online abuse has taken during the pandemic.
Thank you, Heidi. Again, I'm Chris Tenove. I'm the Assistant Director of the Center for the Study of Democratic Institutions at the University of British Columbia. And Heidi and I have been doing research for a few years now on how disinformation and abuse target public officials online, including journalists and politicians. And for the last couple of years, we've been looking at the situation with health communicators. And so some of what we're going to share here draws on interviews with about 35 health communicators and a big study on Twitter. And these are findings that we'll be publishing in the coming months. So what have individuals been facing? Well, most strikingly and in some ways concerningly, there have been threats or wishes of harm directed at health communicators. This is particularly the case for prominent individuals such as chief medical officers in provinces. Sometimes these are very explicit, and sometimes they're ambiguous. And so we heard from interviewees about concerns they have about language that is accusing them of committing crimes and therefore suggesting they should be prosecuted or even held to account in something like the Nuremberg trials that followed World War II, which very famously ended in the hanging of many of the defendants. A challenge with these kind of ambiguous threats in particular, but also with threats that use anonymous identities, is that it can be hard to assess the risk that people really face of violence. And so sometimes this makes it more challenging to address these. A second category of online abuse that people face has to do with racism, misogyny, and other types of identity-targeted abuse. And this is part of a broader context during the pandemic in which we did see more activity of hate groups and that those groups were also engaged in communication about and reaction to public health measures. And so what this looks like is that for health communicators who belong to marginalized groups, quite often they have encountered at least some messages that are targeting their identities. Again, sometimes explicit and sometimes ambiguous. With respect to women, we a number of the people we spoke to face kinds of criticisms of their capabilities or competence that probably would not have been faced by, say, a male physician or a male scientist. A third category of abuse that health communicators are facing has to do with conspiracies around the pandemic and the public health responses to it. And then a fourth area, and one that has more gray in it, has to do with accusations of incompetence. So attacks on people's reputations and the quality of the work they are doing. And for this one in particular, individuals that we talked to pointed out that these criticisms and sometimes the forms of abuse around their competence are coming from different perspectives with respect to public health measures. From those who think these are too onerous, they're too much of a impingement on our rights and freedoms, and for those who think they are too lax, they are not seriously addressing the pandemic itself. And especially when we're thinking about this last category, I think it's important to remember that we do want criticism and robust debate around the science and the public health responses in the pandemic. And the interviewees, the health communicators we talked to were clear about this, and that some mistakes had been made in policy and policy communication. So as much as we want to identify what is abusive, we also definitely need to account for the fact that there is going to be very charged communication on these issues. So I'll now talk a little bit about what some of the consequences are of online abuse that health communicators face. One area has to do with safety, or the threats to security, or the sense of security of individuals. A second one has to do with the mental health toll from being the target of online abuse. It's something that many, almost all of the health communicators we spoke to flagged as an issue they were facing, and we'll hear more about that shortly, the mental health dimension. A third issue has to do with the professional security, the economic security of those who are being facing, in particular, smears on their reputation and other forms of abuse. There are real concerns about whether there might be some impact on their ability to get future work or to work with others because of these attacks. And then the last area, and a really important one, was that online abuse was harming their ability to effectively communicate with publics. Perhaps for some, because they are spending a lot of time trying to identify extensive misinformation out there, which some referred to as the pollution of the information space. Sometimes due to the emotional toll from dealing with this, but also due to the way that these issues around the pandemic and public health measures were intensely politicized over the last few years, which made it often difficult to get into public conversations without the kind of facing at least some of this hostility and pushback. And health communicators were concerned that by having to communicate via social media platforms, which are important to reach certain audiences, they're also being pulled into the platform's game, which emphasizes more charged and sometimes divisive conversations. And so figuring out how to address that information space is really important. So for more on the challenge of social media platforms and issues of online abuse, I'll turn to my colleague, Elizabeth.
Hi, I'm Elizabeth Dubois. I'm an associate professor at the University of Ottawa, where I'm also a university research chair in politics, communication, and technology. And right now I am a fellow at the Berkman Klein Center at Harvard University. My research focuses on political uses of digital media and political communication more broadly. Today, I'm going to talk a little bit about some of the work I've been doing looking at online abuse of journalists and health communicators. All right, let's talk about online harassment's impacts on people's abilities to do their jobs. We really need to understand the types of content that are most damaging, the kinds of ways that people with different identity characteristics are targeted, and what their responses are. So let's talk about some of the early findings from our research. We looked at gender and race as two specific identity characteristics to try and understand how they shape uncivil or harassing content that journalists face. We see that there isn't a huge difference in terms of the amount of content, but what we do see is the types of content are pretty different depending on gender and race. Those who are not white and not men, unsurprisingly, tend to get content that is much more challenging to deal with. There are differences in terms of not only the type, but also the impact and the ability of these people to then manage the negativity that they've received. There are more support structures for some groups and less for others. It's also interesting to note that in our research, we found that there is a difference in terms of who receives support once they've been attacked online. So a common concern in our interviews was people didn't want to appear to be playing the victim. They didn't want to call out the negativity for fear of looking like they were trying to present themselves as victims, or for fear of getting more attacks. What's interesting is we see that people who are not white and people who are not men tend to receive a little bit more positivity in certain circumstances, which suggests there is this potential for support in our online systems to really make a difference. All right, I've got a question for you now. After I present the question, I recommend you pause this video and reflect on the types of abuse that you may face or face in the future. Knowing these types of abuse that you or your organization might face can help you prepare to address them. So some of the things you might ask yourself or discuss with your colleagues are, have you or your organization been targeted with online abuse in the past? If so, what was the trigger? Who was targeted? How were they targeted? If not, what do you expect might be situations you're most likely to encounter abuse in the future? All right, over to Saima to discuss some of the impacts of online abuse.
Thank you, Elizabeth. Hi, everyone. My name is Saima Hirani, and I'm assistant professor at UBC School of Nursing. I'm also a co-director for a research unit called Critical Research in Health and Healthcare Inequities. So my research relates to mental health and mental health promotion, especially for individuals who experience socioeconomic challenges, including abuse and violence. So one of the frameworks that you can see on the slide that drive my work is socio-ecological model, which tells us that mental health is everyone's responsibility, and we need interventions at all levels if we want to promote mental health of people. So mental health promotion is a strength-based approach, and I use this approach in my program of research to focus on empowering people, emphasizing what factors and intervention can enhance the capacity of individuals so they have the ability and resources to optimize their own mental health and support others' well-being. So we know the association of abuse and mental health is well established in literature in many contexts. In the context of health communicators, especially, evidence tells us that when the burden of abuse increases due to increasing communication demands, direct exposure of communicators through online platforms, and various other related factors, people are more likely to experience burnout, emotional exhaustion, anger, frustration, withdrawal, and other emotional and mental health challenges. So my role in this project is to support mental health piece, of course. Our team is interested in assessing and understanding psychological distress, resilience, and social support of our participants in relation to online abuse. So our aim is not only to understand our participants' received social support, which is the quantity or availability of the support they have, but perceived social support, which is about their satisfaction with the provided or available support. Because we know, and there is a strong relationship developed already between perceived social support and improved mental health outcomes. So through this collaborative project and using the mental health promotion lens and participatory approach, we are working with health communicators to better understand factors that increase their vulnerability for experiencing mental health issues and suggest better and effective sources of support that our participants want to see at all levels for the health communicators community in general, and in particular who are in vulnerable situations.
Thank you, Saima. My name is Jaigris Hodson, and today I'm going to discuss work that I've conducted with my colleague, George Valetsianos at Royal Roads University. In particular, I want to talk about how we can support others who are going through online abuse, what kind of support people need, and what interventions might be useful at helping address this problem. Next slide, please. So when we think about support for people who are facing online abuse, it needs to occur at multiple levels. And what we know is that much of it occurs at an individual level. So that means a person who will say report, block, not feed the trolls. We hear that expression quite a bit, right? And while this is helpful, and while some people enlist the help of their family and friends to do the same thing, support, block, etc., we find that there's a lot of support missing at other levels, which make people still, feel nervous for their career. They can suffer economic impacts. They can suffer things like burnout because they're just not getting what they need from their organizations or from professional bodies at the sectoral level, or even from laws and policies, at the government level. So we really need to start thinking of support, not just as something an individual can do or an individual's family and friends can do, but something that we're all implicated in. And research has shown this. We've conducted literature reviews and also our own research, asking people what kind of support they needed, found out that really we need to think of a whole society approach to supporting people in online harassment. Next slide, please. So for example, when we did talk to people, we heard that, personally, they use things like resiliency or situational awareness. I mentioned families, friends, and colleagues before. But other levels of support that people were looking for include technological. So platform settings, we need that to be there. Institutions and policies, we need to be there. And of course, law enforcement, we need to be available, depending on what community you come from, of course. But what we were also told is that the institutional policy isn't where it needs to be often. Often the platforms don't help when you report. And often, law enforcement, for example, doesn't take online abuse seriously. Similarly, existing attitudes towards things like gender or race can complicate things and make support even harder to come by. Equality for all is really needed to create the support that people need, but we're not there yet. And media representations of online abuse often go back to that individual "don't feed the trolls" narrative. This isn't helping people, and so we need to do more to shore up those sources of support. Next slide, please. Other barriers, when we talk to managers, we found that they're aware that the problem exists, which is great, and they're aware that it can have negative impacts, specifically on marginalized population, but they're unsure of the scope of the problem. People aren't telling their managers because people don't feel safe telling their managers because of the cultural concerns above, or the fact that organizational policies don't yet exist. So managers suspect that people experiencing abuse aren't speaking up. And there's also a tendency to try and take a control and punishment approach. In other words, what managers try to do is control the problem at its source. And so they tell us when the perpetrator of online abuse is anonymous, they can't do anything because, obviously you have no power over an anonymous person. But there are so many other ways to provide support for people who are experiencing online harassment. You can tell them that you are there for them when you need them. You can take their concerns seriously. You can set up IT solutions through your IT departments, etc. And oftentimes those other approaches that don't rely on punishment weren't even considered. And then, police and platforms are not helping either. The support provided is often limited. And so managers don't even feel often that they could go to these other organizations and have any effect at all. So what we're seeing is that what people need and what is currently available, there's a big gap there. And so, if we're talking to, for example, our organizations or our professional associations, I think we can demand better, and we can ask for new, different, and more creative forms of support. What we call for example, is a new process-based approach. So rather than simply, having a policy of punishment, what is a process that you can enable at your organization to support other people who are going through a tough time as a result of online harassment and abuse? And next slide, please. Now, one of the things you can do right away is you can be a good bystander. And so, we're beginning research on bystander intervention. And what the literature tells us is that bystanders can be most effective at countering visible harassment. So, those are, say, seeing a negative message on Reddit or Twitter, et cetera, a lot of those platforms where you can view it and you see it directed at somebody else. And what does bystander intervention look like? Well, think of the 5 Ds: direct, distract, delay, delegate, and document. Right? And this has been in the literature used to understand bystander intervention for harassment that takes place in person, but we can easily apply it online, right? So you can help distract the target of abuse from the abuse and provide them with positive messages. So a wave of positive messages, right? You can block, you can report when you see it happening. And that's part of the documenting part. You can delegate, you can call in other people to help out, to help send positive messages to the target and to help block and report negative messages, right? And you can call on your own professional organization. You can call on your own institution to do better. And I think this is one of the ways that we can have an immediate positive impact. You want to be a good bystander, you want to support people who need it. You can also simply ask if you are familiar with the target. You're not maybe just a lurker on social media, but you know them, you've interacted with them. Step up. You say, I want to help. What can I do? Can I block this person for you? Can I, take over your social media accounts for a while if you're close to that person? Can I call your dean and send a message of report? Can I call your boss? Sorry, I work a lot with academics. Can I call your boss and send a message of support to them to counter all these negative messages that you're getting? And if we do that, we can create a wave that will help to shift these problematic cultures that we found sort of get in the way of support. And another thing we're looking at moving forward is what could bystander intervention education look like? And while we don't have all the answers for this yet, I think it's important, again, in your own work and your own life to educate those around you and to tell other people to be a better bystander. So what that means for you is if you're watching this video today, think about the ways you can call in other people to do this work too, because together, we will be much stronger than we are currently. These are some considerations, right, to keep in mind when it comes to minimizing the harms from online abuse and remembering that you are more powerful than you think you are, right? And just sort of a final piece, it's helpful to have an action plan in mind ahead of time, right? Don't wait until online abuse occurs. Think about now, write down some notes about how you can be a better bystander, how you can support, and what kind of support you want from your organization. And so to facilitate that, we wanted to end the workshop with 2 scenarios. And this will give you a chance to start to think through what your plans might be, right? And one's going to focus on individual responses. The other might focus on what employers or other institutions can do. There's going to be no one right response, right? There's nothing that's going to work for all individuals and all organizations. So learning from the people about different forms of support they want and they need, and that's why we recommend talking to people, that is critical. But let's start with a scenario, like what can you do? You are a communications manager for a public health authority. A physician affiliated with your organization was quoted in a news article on policies regarding masks. Now you're on Twitter and you see that they've started to face abusive messages as a result of this news article. What would you do to help?
Thanks, Jaigris. We'll move to our second and final scenario now. For this one, the emphasis is on your organization and what it can do to help manage online abuse and provide support to its staff or members. So here's the scenario. Your organization is planning a communication campaign about a new COVID-19 variant, led by a new staff member. And based on previous experiences, you and other colleagues worry that this may touch off a flurry of abusive messages online. So 2 questions for you to consider. First, what policies does your organization already have in place that your colleagues should know about? And second, what new policies should be implemented before that communication campaign is rolled out? So some of the policies types that you could think about are these. Do you have any public-facing announcements or posted policies that explain to users of your website or your social media pages what kinds of communication from them crosses the line or unacceptable, may lead to them being blocked from accessing your material? Is there someone that your organization employs or that they can reach out to who may be able to assess risks posed by threatening messages? And do you know at what point you might involve the police? Do you have a policy at your organization for what you do if a staff member's home address or other private information is released online? Or what if there's a campaign of accounts that are trying to defame them? So remember, there's no perfect organizational response, and these are all really tricky situations. But an important thing to keep in mind is that if there's no response or a poor one, the target of abuse can be left feeling isolated, at risk, ashamed, or neglected. And by contrast, an effective response can be an opportunity for the organization to demonstrate to its staff and members that they are supported and they are valued by their colleagues. So please pause the video now and think about the policies that do exist or should exist to address a situation like the one I've described. Okay, well, this is almost the end of the workshop. And by this point, hopefully you will feel confident and have achieved the following learning objectives. You'll be able to explain why health communicators face greater online harassment and abuse during the pandemic context. You can describe various forms of abuse and hostility that health communicators face, including differences that may relate to individuals' identity, including gender or racialization. You can now better understand the professional and personal impacts that online abuse can have. Hopefully, you can identify a range of responses or forms of support that may be pursued to address online abuse, whether taken by individuals or organizations. And then with this last exercise, hopefully you've come out of it being ready to propose strategies that you and your organization may wish to put into place. So that is now the end of our workshop. Thank you very much. And I hope you get the opportunity to enjoy and benefit from some of the other workshops in this series.
This workshop was created by the Center for the Study of Democratic Institutions and colleagues in collaboration with the Pacific Institute on Pathogens, Pandemics, and Society. We gratefully acknowledge funding for this workshop series provided by the Canadian Institutes of Health Research and the Pacific Institute on Pathogens, Pandemics, and Society. This workshop is part of a series on social media communications. To access other workshops in this series, visit youtube.com/@PIPPSBC, @PIPPSBC. If you have comments or questions, you can follow us on Twitter @PIPPSBC or reach us at smbc@sfu.ca.